My daughter Casey has vesicoureteral reflux. Vesicoureteral reflux, which is sometimes called VUR, is a condition in which urine can flow backwards from the bladder up towards the kidneys.
Urine is made when the kidneys filter fluid and byproducts from the blood. Urine then travels from the kidneys down tubes called the ureters and into the bladder. Urine is stored in the bladder until the child goes to urinate or to pee, which causes the bladder to empty. In healthy children, urine is unable to travel backwards from the bladder back into the kidneys. However, in children with a medical condition called vesicoureteral reflux, or VUR, urine doesn't stay in the bladder and instead is able to travel back towards the kidneys from the bladder.
Casey started getting bad urinary tract infections. From what I hear, most kids' symptoms are mild with a UTI, like burning when they pee. But Casey was really uncomfortable with high fevers and a lot of kidney pain. She had to take antibiotics for several weeks to treat those infections. After the second one, when she was just about 3, her doctor wanted us to get some tests. One was an ultrasound of her kidneys. That wasn't so bad. But the other one was an X-ray test called a VCUG. For the VCUG, she needed a catheter in her bladder. She did not like that. But I guess when I think back, it probably wasn't any worse than the IV she had to get for IV antibiotics.
Vesicoureteral reflux often doesn't cause symptoms and can go away on its own in many patients. However, it can have negative effects on a child's health, such as kidney infections, scarring of the kidneys, and in some cases even loss of kidney function. Loss of kidney function can cause high blood pressure or, in extreme cases, even cause a child to go into kidney failure. Treatment for vesicoureteral reflux varies. As I mentioned before, many children will outgrow the condition. Therefore, some children are simply monitored with yearly appointments and X-ray tests to see how they're doing. Others need to take daily antibiotics to prevent infections. Still others require surgical procedures to repair the faulty connection between the bladder and the ureter and to cure their reflux.
On the outside, Casey looks just like any other kid. She just started preschool and she loves to draw. She does have to take medicine every day to prevent more urinary tract infections. She does great with the medicine. I do worry when we miss a dose, but we've been remembering almost every single one. The other thing I worry about is, what if she does get another kidney infection? Her doctor told me that if she gets another infection, she's going to need surgery to fix her VUR.